So one of the biggest mistakes that nursing students make is thinking that stable means healthy, and it doesn't. A patient can be very sick and have multiple chronic conditions and still be considered stable. On the NCLEX, stability is based on whether the patient's condition is expected and unexpected, not whether they're healthy. So for example, a COPD patient with an oxygen of 88% may look concerning, but if that's their normal baseline, they're stable. Or a dialysis patient with a creatinine of 6 is unhealthy, but that's expected for end-stage renal disease. Another example is like a heart failure patient with chronic leg edema and swelling. That's unhealthy, but it isn't getting worse and they're breathing normally, so they're stable. Now let's compare those to an unstable patient. So an unstable patient is experiencing a new unexpected change. So maybe that COPD patient's oxygen saturation suddenly drops from 92 to 82%. Or maybe that heart failure patient suddenly develops crackles, shortness of breath, and then low oxygen levels. Or maybe your confused dementia patient suddenly becomes a lot more confused than their normal baseline. Ask yourself, is this expected for this patient, or is this a change from their baseline? So a patient doesn't become your priority because they're sickest. They become your priority because they're getting worse.